A stroke is a serious medical emergency. It happens when the blood supply to part of your brain is cut off. This means your brain cells are starved of oxygen and nutrients. Without these, brain cells can become damaged or even die. Strokes are often called brain attacks. Like a heart attack, a stroke needs immediate medical attention. The sooner treatment begins, the better the chances of recovery. It's important to remember that strokes can happen to anyone, but the good news is that many strokes are preventable. Understanding the risks and symptoms of stroke can make a real difference. Knowing the signs of a stroke can be life-saving. Remember the word FAST. It stands for face. Is one side of the face drooping? Can the person smile or show their teeth evenly? Arms. Can the person raise both arms and keep them raised? Is one arm weaker or numb? Speech. Is their speech slurred? Can they understand what you're saying? Can they repeat a simple sentence? Time. If you notice any of these signs, time is crucial. Call emergency services immediately. Other possible symptoms of a stroke include sudden numbness or weakness, especially on one side of the body, sudden confusion, trouble speaking or difficulty understanding speech, sudden trouble seeing in one or both eyes, sudden dizziness, loss of balance or trouble walking, and sudden severe headache with no known cause. If you suspect a stroke, even if symptoms are mild or disappear quickly, seek medical help immediately. Don't delay. Doctors need to act fast to minimize brain damage. At the hospital, doctors will work quickly to diagnose the stroke and determine the best course of treatment. They may ask about your medical history and any symptoms you're experiencing, perform a physical exam to check your reflexes, vision, and coordination, order blood tests to check for clotting factors and other indicators, conduct imaging scans such as a CT scan or MRI to visualize the brain and blood vessels, and perform an electrocardiogram, an ECG, to check your heart rhythm and detect any irregularities. There are different types of stroke, each requiring specific treatment approaches. Ischemic stroke is the most common type. It occurs when a blood clot blocks an artery supplying blood to the brain. Hemorrhagic stroke happens when a blood vessel in the brain ruptures, causing bleeding in or around the brain. A transient ischemic attack, often called a mini-stroke, is a temporary blockage of blood flow to the brain. While symptoms are usually brief, a TIA is a warning sign of a potential major stroke. Treatment for stroke depends on the type, severity, and location. Medications, therapies, and lifestyle changes all play a role in recovery. The good news is that many strokes are preventable. Making healthy lifestyle choices can significantly reduce your risk. Quit smoking. Smoking damages blood vessels and increases your risk of blood clots. Eat a healthy diet. Choose fruits, vegetables, whole grains, and lean proteins. Limit salt, saturated and trans fats, and cholesterol. Stay active. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Manage underlying conditions. Control blood pressure, diabetes, and high cholesterol with medication and lifestyle changes. Remember, stroke recovery is a journey, and everyone's path is different. Be patient with yourself, celebrate small victories, and seek support from loved ones, healthcare professionals, and support groups. By taking steps to prevent stroke and seeking prompt medical attention if symptoms arise, you can protect your brain health and live a longer, healthier life.